Good morning. It's News from the Roots on Mountain Stream TV. Today is Monday, April 8th, 2019. I'm Avram Friedman. And today we have a special guest. We have Carrie McBane from Down Home, North Carolina, a great organization that's been doing wonderful work for the last couple of years now, I guess. And Carrie, let's talk a little bit today about the work of Down Home, North Carolina in general, but specifically about an upcoming event you have on April 22nd, I believe.
Correct. So we are putting together or sponsoring a town hall meeting
Okay.
on April the 22nd from 6 to 8, and I believe it's at the Moot Center.
Mm-hmm.
And so we are...
That's in Waynesville.
That's in Waynesville, that's correct.
Mm-hmm.
And the reason we're doing this is to spotlight the Medicaid expansion bill, and specifically clean Medicaid expansion. And so clean Medicaid expansion basically means no stipulations to applying for or qualifying for Medicaid. And because there is such a crisis with health care, access to affordable health care, access to health care in general for so many citizens of North Carolina, we feel it's necessary to support this town hall meeting, to ask questions and to hear people's stories about how they have either been part of the healthcare crisis or know people that are part of, which I think pretty much everyone, either through family, friends, acquaintances, knows somebody that's been touched by the healthcare crisis or lack of access to healthcare. And so Down Home North Carolina, being a member-led organization, we really strive to put and bring forth issues that the community deems important and relevant, which are so many things these days. And so this is mainly to help all of us as members of Down Home and our surrounding communities so that we can be heard to our politicians and heard to our communities as well. I know it can be very shameful to admit to not being able to afford health care coverage. I am one of those people, and I have felt shame for not having employment that offers health care coverage. But we do live in the Western Carolina mountains, and employment is different here than it would be in the big cities. So anyways, Down Home sees this as an opportunity to expose the healthcare crisis, especially here from the mountain point of view, and to push the issue, push legislation through for Medicaid expansion. So this is the purpose of the town hall. We are looking to have, again, people, if they're willing to tell their stories, we're inviting people from the healthcare industry, medical professionals, to sit on a panel to hopefully answer questions or even go over their own stories for maybe clients that they've seen that they know that are suffering from lack of health care. But Down Home this is just one of the issues that we are focused on for right now because it is such a big issue, such a crisis.
So let's go over a little bit about the recent history of Medicare expansion or the lack of in North Carolina. Medicaid expansion was mandated by the Affordable Care Act, essentially, otherwise known as Obamacare. So it's interesting, when they do public opinion polls about Obamacare versus the Affordable Care Act, that people who don't know it's the same.
It's the same thing.
A majority will voice opposition to Obamacare, but overwhelming support for the Affordable Care Act.
Right. Yeah, it is essentially the same thing. That's right.
It is the same thing.
Right.
I mean, it's the Affordable Care Act was passed under President Obama with no Republican support at all in either the Senate or the House of Representatives on the federal level. And it squeaked by. Even some Democrats, just very conservative Democrats, voted against it apparently, and but a vast majority voted for it, and it passed. And because of that, we now have protections in health insurance that didn't exist before, including covering pre-existing conditions for people, etc. But part of that law also left it to the discretion of state governments whether or not to accept Medicaid expansion. And North Carolina is one of the states that decided not to accept Medicaid expansion. And to be clear, this is money from the federal government that is actually a return of money that's already been paid by the taxpayers from North Carolina to the federal government through Medicaid, through payroll taxes, and so this is money that we have already paid in taxes that would have come back to North Carolina, billions of dollars.
Yes.
That would have been able to insure, as I understand it, 300,000 to 500,000 more people in North Carolina than currently are insured. Low-income people desperately in need of health care coverage. Correct. That are not being covered because the people in the North Carolina General Assembly, our representatives and senators in our state government, refuse to accept that money from the federal government, basically because they were protesting against the passage of the Affordable Care Act. Correct. Didn't like President Obama. And so for that, 300,000 to 500,000 people are suffering.
Absolutely,
in North Carolina.
The range is closer to 500,000 of uninsured North Carolinians, yeah. And it's, it's outrageous that the government of North Carolina would allow that to happen and continue to allow that to happen, because the money, we as taxpayers, you pay your taxes, you pay into the system, and what happens is, because they're not taking advantage of the funds being offered by the federal government, those funds are dispersed to other states to help cover their citizens. So we're actually paying for other people to be covered in different states. Now, I'm not saying that's a bad thing, that I don't want other people to have health care coverage, of course, but if I'm paying my taxes here in North Carolina, I'd like to know why they're being spent in different states. I think there's approximately 13 states that haven't passed, that haven't expanded Medicaid. And this is what we're pushing for. It is egregious and unconscionable on many levels, on any level, I think, that the state of North Carolina allows its citizens, its constituents, to suffer for, and I can't speak for a lot of politicians, but what it seems like it's petty. It's childish. It's childish, and the reason we call it clean Medicaid expansion is because and I see mainly Republicans, the Republican Party, that opposes the Medicaid expansion. They're wanting to add stipulations for people to even apply. And
there are other states that are controlled by Republican houses and senates and governors who have accepted the Medicaid expansion because they're smart.
Right.
They understand that this decision is above politics, or should be above politics, and the federal government is willing to give them billions of dollars to insure their low-income people. They've accepted it, but not in North Carolina.
Not in North Carolina, and,
yeah.
And certainly not in the Western Carolina mountains. I think the last time I was here, I don't know if I mentioned, but I always wondered why I never saw any politicians I never saw anybody roll through the mountains and ask how their constituents were doing. And they really have a different view of us here in the mountains, which is extraordinarily unfair and completely pigeonholes the people in the mountains. And so this kind of all gets rolled up into this weird idea they have of us here in the mountains, but also throughout North Carolina in general. For some reason, they think that they think that they know what they're doing, but they don't, and they're not taking into consideration the actual constituents. It's like they are just making these decisions based off what they want, what they think is right, and it's like that's not okay with me. Certainly if you're not coming to my area to ask how I'm doing and what I have access to and how I'm living, I don't believe that that's fair. I know it's not fair, and I also don't. I have my own healthcare issues as it is, and have struggled for the last year. So this is a very big issue for me.
What I've heard some of the Republican opponents to the Affordable Care Act say is, well, we don't want to put any more money into Medicaid because it's a broken system. Well, it's a broken system because they broke it.
Right.
It was working fine. I mean, it was insuring a lot of people who needed it, and it still is. I mean, Medicaid. Let's talk about some of the costs, some of the things that Medicaid covers. One of the main things it covers is long-term care for people who can't afford it. Now, if you ever have had a loved one, a grandmother or grandfather who was confined to a nursing home, you'll know that I would say most people simply could not afford that on their own.
Right.
It costs $5,000 to $6,000 a month to keep somebody in a nursing home, and I went through this myself. My mother was 93 years old when she died. For the last 3 years of her life was in a nursing home. Cost $5,000 or $6,000 a month, and I could not have done that without Medicaid at that time, and there was no way I could have cared for her at home. I did for as long as I could, but she every time she stood up, she fell until she broke her hip, and the doctor said to me, you have to put your mother in a nursing home. And if that money wasn't there, I don't know what would have happened. And I'm sure that there are tens or hundreds of thousands of people in that same
Absolutely, same situation. Well, that's the thing, is they're making it just about the fiscal part of this, the money part, the financial part is, it seems like the aspect that they are using to drive home their point that this is not necessary, but that's not true. There is more than just money involved here. There is the emotional part of people that are suffering without their medications. In your situation, not being able to take care of their elderly parents or elderly family members, children, things like that. There's more to it than just money, and then just, I don't know, it seems very limited. Their scope of viewing these things is very limited. And this is what we're not trying to attack them for having their opinions or for doing their job, so to speak, but you really need to look at it from different aspects. How you can spin a coin on a flat surface and it spins and spins and spins till it falls over. Mm-hmm. The reason it spins is that it's on a flat, even surface. Mm-hmm. We need to have an even playing field where all our citizens are concerned. It's just not right that you are part of a government, whether you're a senator or congressman, and you have your health care coverage. And even though I am not part of the government in that respect, I deserve to have access to health care coverage. This has to be a level playing field. Why does that coin spin? Because it's on a level surface. And this is where we're trying to get our senators and our congressmen congresswomen, congresspeople, to see that. You're missing the compassionate component of this. You know, there's more than, it's not that people just want to get one over on the government and live off government programs. I know many people that don't want to do that, that
Nobody
don't
wants
like
to
doing
do that.
that.
Yeah.
And so, but why you put group everyone together and especially for the mountains, pretend like we don't exist here or that we're only out to get one over, that is not true. I don't like being depressed because I don't have access to medications that can make me healthy again or keep me healthy. I don't like being tired all of the time, having all these symptoms. I don't like seeing my friends and family who have illness or disease not being able to be treated. You know, a lot of people, they're like me. I'm afraid to get even more sick because then I end up in the emergency room, and then you have all these emergency room visits and these bills that you can't pay for. You know, people can't see a regular general practitioner. They don't want to go in the emergency room, so they're suffering basically in silence because obviously we're not being listened to right now. So a lot of people aren't willing to come forward. So the reason for the town hall meeting is to invite people. You know, we only have a certain number of spaces for people on the panel, but we are having kind of like a Q&A session at the end, and for people who want to come and go over their story, or other people that they know their stories. You know, we want our governments to hear this. This is the purpose for this, so they can have a voice.
So I guess, you know, the conservative take on this is that, well, there's all these lazy people out there who just aren't willing to work to make the money that they need to afford health care. And so, as you start to say, they are, what they're proposing now is to put all types of stipulations on the reception of Medicare or Medicaid. And what are some of those stipulations?
Well, I don't know if I mentioned them earlier, but the two that I'm aware of, and there might be more coming or more that have already been put out there. But so one would be that you're required to be drug tested. The other one is that you'd be required to have a job. And so the issues with that, and I'm just putting this, simply stating this from what I understand, is that, and I have known addicts of all kinds, and I don't understand the rationale behind that is because most addicts that I have been acquainted with aren't concerned about having a full-time job. You know, they're self-medicating. And so going to work for 40 hours a week doesn't necessarily play into your plan of wanting to self-medicate. And so requiring someone to have a job to even apply for Medicaid, you know, but you're in the same breath, you're saying, well, you need to get help. You need to get treatment, but you're not allowed to do that unless you have full-time work. And it's like, so I don't understand how that is supposed to, how you expect that to work. Again, I'm not saying this to shame addicts, and I have certainly been through my own issues to where I was depressed and self-medicating to a point. I wasn't concerned about work.
So what drugs are they talking about testing for?
I haven't heard specifically, but I'm sure it's opioids and
marijuana.
Marijuana. You know what? I wouldn't put it past them to drug test for whatever they wanted to.
Right, but I mean,
from what I understand, it would be opioids and marijuana.
So
meth.
Illegal, drugs that are currently illegal. If they're addicted to prescription drugs, they're fine. That doesn't matter.
Right, correct. Yeah, and we'll put out more prescription drugs so that you can possibly buy them. Well, it's just, a couple months ago, if not a couple months ago, I was listening to the news and reading an article where the FDA just approved a painkiller that's more powerful than fentanyl. And I was like, I don't understand. You're touting that we have this opioid epidemic, which of course we do, but yet you're allowing a stronger painkiller than fentanyl to come out on the market. Like that just does. I mean, it's to me, it's a lot about money. A lot of things are a lot about money. I think I'm safe to say that. But so the drug testing is one part of it, and then besides drug testing, what did I say? The having the job, having work. These are things that just those two kind of go hand in hand. Again, most addicts that I have known aren't concerned about the work. You're more concerned about self-medicating. And so it's just these stipulations, just more things to add on. And it's basically provisions to block people to access Medicaid is what it is.
But it wouldn't require that of all people. I mean, elderly people would have to get work?
As far as I'm aware, I have not heard anything differently.
Well, that's insane. I mean, that's crazy.
Well, it is.
I mean, there are people who legitimately are disabled and either because they're elderly or because they're veterans and suffered injuries and mental incapacity, post-traumatic stress disorder and other, other injuries that leave them incapable of working a full-time job. And how can you possibly require people like that to work?
Exactly. And the reason I hesitate on saying some of this is that because we can't even get our Republican senators and congressmen to even get past even saying the clean Medicaid expansion. They're looking at it as just Medicaid expansion. They're not even wanting to use the word clean Medicaid expansion because that means no stipulations. Whereas they're saying, we might be willing to pass a Medicaid expansion bill, but only with these stipulations. So it's not even. I was in Raleigh a month ago, along with a group from down home North Carolina and many other organizations that visited the Capitol at the same time, and I really was unaware of how. And we just visited Republican senators and congresspeople. And I really was unaware how, what's the word I'm looking for? They really mean what they say. This is not just, they're not just saying, we don't want clean Medicaid expansion just because we don't want it. They really believe that if you took, and this is coming directly out of someone's mouth, if you took better care of yourselves, you wouldn't need access to affordable health care. And you do understand that health care is a privilege. I was so shocked when I heard that coming out of the mouth of someone in a public official. I just could not believe that it's really the idea they hold dear to. It's really about
that
money.
Medical care is a privilege.
Medical is a privilege
instead of a right. Yeah.
Right, and I was so amazed that somebody actually said that.
Well, I unfortunately I'm not shocked that they would say that because I've been hearing it so much, but it amazes me the stupidity behind that thought. Don't they understand that if there are people who are afraid to go to see a doctor, if there are people who are walking around with diseases and that are getting worse and worse, and because they can't afford the preventative care that they need, that it's going to impact the health of the entire country and the productivity, if you want to put it down to dollars and cents, of workers and people who can't afford health care. And you're gonna have people who are gonna be walking around and not getting vaccinated when they need to get vaccinated. It's gonna spread infectious diseases throughout the country, and it's gonna raise crime rates because desperate people do desperate things. There's so many reasons why everybody's quality of life suffers if people don't have adequate health care.
Absolutely. It really touches everybody, and that's what they're not covering. That's what they're not saying is that, when you allow people access to proper health care, they are willing to seek treatment.
Mm-hmm.
They can have access to their medications. They can see providers that want to see them healthy, which in turn means they can go back to their lives to be, I've lost the word, to be productive members of society, as the Republican Party likes to say. We want to see productive members of society. Well, yes, we do. So how about we allow people access to health care coverage so they can return to being productive members of society? Most people I know don't even look at it that way. They want to be healthy. They want to go back to work. They want to take care of themselves, their family, their pets. This is part and parcel of the Medicaid gap that we're seeing and the lack of coverage. That also means that there aren't outstanding emergency room bills, outstanding doctor bills. When people are healthy, they go back to work. The federal government foots 90% of the Medicaid expansion, and the healthcare industry has the other 10%. They're going to make their money. They will see their return. And then on the flip side of that is people can stay healthy. They can stay productive. This is as far as I'm aware, I don't know anyone that I know of, and that's just for me speaking, that wants to stay home all day and be sick. I mean, nobody really wants that. And so I really feel like it's the compassionate component that's missing. They're just not seeing the other suffering part. And honestly, if you have not been through an illness or disease for a lengthy amount of time, you just really don't understand. But how about asking people? Mm. And so I was just going to read a couple of facts that I had real quick so that people understand. So in other states that expanded Medicaid, nearly a 20% increase in admission to treatment facilities. Kentucky had a 700% increase in Medicaid beneficiaries using substance abuse treatment. In West Virginia, the share of uninsured people who were hospitalized decreased from 23% to 5% in 1 year. Now that's for states that expanded Medicaid, and the benefits of Medicaid expansion for North Carolina also include you can increase the number of people who have access to treatment and care, which we went over. You reduce the number of people in our prisons incarcerated for a health disorder. You reduce the number of children in our foster care systems and strengthen families. You decrease the reliance on emergency rooms for care, which I absolutely agree with. Absolutely. And you reduce the unnecessary deaths from preventable overdoses and other health issues related to drug use. And that's very true. That's what we're pushing our government to realize, that there are other benefits from this. It's not just one thing. It is a whole. There are numerous components to this, and we just want them to see that. Our intention is not to have a town hall to bash a certain party, because both parties are complicit with this. We're wanting our government and our elected officials to see how their constituents are suffering and how it is extraordinarily unfair that this is allowed to happen, and that they are putting, as I've said before, a price tag on people's lives. It's about money. It should not be, the sole component should not be about money. It should be about seeing your constituents healthy and happy and pursuing a well-deserved life. I don't know quite how else to say that, but I just think that they're missing so much more to this, and we just want them to see that. Again, it's not about bashing, it's about opening their eyes to something more than what they are.
One aspect we haven't touched on yet, however, is that the money will create many jobs.
Absolutely.
In North Carolina. And healthcare facilities that are being threatened with closure now will be saved, especially in rural communities.
Absolutely.
And we're touched by that heavily in North Carolina and in Franklin, Angel Community Hospital is closing their labor and delivery, or has closed their labor and delivery
That's
service,
correct.
and all over the state in rural communities that's happening because healthcare facilities are being run for profit now rather
Right.
than for the purpose of serving the communities. And with this influx of billions of dollars from the federal government in Medicaid, what that essentially would be going to is creating more healthcare jobs.
Right.
And we're talking about tens of thousands of jobs.
Absolutely.
Yeah.
It's more than just the one little part that they're sharing. And I think they know that, which is what frustrates organizations like Down Home that just are wanting to help empower people that don't know how to use their voice or have been ignored or overlooked for so long.
Mm-hmm.
You know, this is serious. And it's been serious for a long time, but it's getting to be every day that this passes that people are without coverage, you know, is a crisis for them. You know, even if they say, oh, well, it doesn't really necessarily affect me, it doesn't really matter to me. Well, it matters to the person that's dying without their medication, people that cannot take care of their elderly family members. It matters to them. And so this is what the point is we're trying to get across. And I was just looking at some of my paperwork, and one of this does say that, moreover, Medicaid plays an essential role in delivering health care in rural America and is an economic lifeline to many communities. Nearly 1 in 4 non-elderly adults in rural areas currently have health care coverage through Medicaid. Not only do many rural communities rely heavily on Medicaid, but rural unemployment is often higher. Work can be more variable, and transportation and infrastructure challenges make it harder for people to comply with their requirements. These factors will prevent large numbers of rural residents from accessing health care, exacerbating economic challenges for rural hospitals and providers. You know, a lot of people that fall into the Medicaid gap are from working families. And so it's actually 60% of the gap are from working families. So this is not, we're just making this up to make you feel bad. This is actually what's happening. And how do we show you the other sides of this? You know, what else do you need that we can work on? You know, we're part of this too, the organizations like Down Home, you and me. But it's, again, I think it's time that we are given a fair playing field. Really, honestly. I don't understand how it's okay to watch your constituents suffer. Some, a majority of them in silence. So
what's on the table in North Carolina in the General Assembly right now? What bills have been introduced to accept Medicaid expansion?
The only two that I'm aware of, and of course this might have changed, but since I was in Raleigh, we have, I believe it's House Bill 3 and Senate Bill 5 are about the Medicaid expansion. However, as far as I'm aware, the word clean, well, it's in the wording, but it's not being discussed. It's just about Medicaid expansion. But from what I understand, they're still hashing out the wording in those bills.
So who introduced these bills? Do you know?
That I don't remember.
Okay.
I apologize.
But do you know if they were Democrat or Republican or?
As far as I'm aware, Democrat.
In both cases,
Correct,
NC3
yes.
Or H3 and
Sponsored by the
Senate and S5.
Yeah, House Bill 3 and Senate Bill 5.
Yeah.
I believe that's correct. I don't think those were.
So yeah, but there are Republicans who are, the majority is willing to talk about these bills at this point. I think they understand that this
yes
is politically
no.
inviable for them.
Well, that's a huge thing. Is they're
Yeah.
as much as they're willing to push not using the word clean or not putting stipulations in the bills. I think it's also a little worrisome to them that this is gaining a lot more momentum than they expected, and so they are from the senators and Congress people that we spoke to. Let's say congressmen. They were willing to listen to us, but they are not willing to go as far as saying we're willing to vote on a clean Medicaid expansion bill right now. It's possible, but they want the stipulations.
But at the same time, Governor Cooper has said that he will not sign a state budget unless it has a clean Medicaid expansion bill in it.
And I think what they're also trying to do, probably behind closed doors, is come up with something that is acceptable to pass so people can get covered. Now, what exactly that is, I don't know, because they're not going to tell us that. All I know is that they said, well, we're not there yet. These are the stipulations, and these are just from the couple people, elected officials that we spoke to. They were unwilling to budge off of the stipulations, but I think other people are willing to discuss it.
So the little bit of background here, in the last election in 2018, the Democrats were not able to take over the House and the Senate, but what they were able to do is break the supermajority in the House and the Senate, meaning that the House and the Senate can now not override a governor's veto unless some Democrats break ranks. So is there any sense about how the Democrats, how solid the Democratic representatives and senators are in backing Cooper on this, if he vetoes legislation that doesn't have a clean Medicaid expansion?
I have not picked up a sense, and I can't think in the last couple of weeks in talking to anyone or seeing any new information that says they are. When I said earlier both parties are complicit with this,
right.
The general sense that I get from just either watching either the news or reading about what's happening is that some are, but some aren't. It seems like a majority aren't there yet. They're more willing to say it than do it. And it seems like a lot of the political atmosphere lately is about a lot of saying and not doing. And then at the last minute, it's changing the mind. So how do we please this side over here and still look good to our constituents in our states? And I feel a lot of that is what's happening.
Yeah.
It seems like Governor Cooper is the only person that has come out specifically and said, I will veto anything without clean Medicaid expansion.
And he's got the power to do that.
Yeah, well, thank heavens.
Yeah.
Unfortunately, the political atmosphere is so charged nowadays over things that, to me, aren't always irrelevant to the well-being of the constituents. Right. And so we lose our focus on what we're trying, on our agenda. But I get the sense that it's both sides are wanting to come away from this looking good, but aren't willing to put the muscle behind it.
But it's hard for me to believe that there might not also be a few Republicans that understand where the wind is blowing right now and understand that it's really foolish not to accept this money from the federal government, and would break ranks with the Republicans and vote with the Democrats on this.
Well, I think that there are.
Yeah.
I believe that there are. I just believe that they're unwilling to come out and actually verbalize that.
Right.
Because.
But when it comes to a vote, they might vote.
They might.
Yeah.
Like I said, I don't know. Mm-hmm. A lot of it again seems like they're wanting to come off looking better and not do the work behind it. I don't know how to, and I don't know how I don't know how you fix that. I know what I would do. I know what should be done, but when it comes down to brass tacks, it's their vote, and I think that they're unwilling to waver just yet. They might be willing to think it, but they're not. I think there needs to be more muscle put behind this, so that the Clean Medicaid expansion bill can actually go forward. At this point, it's dead in the water. The Clean Medicaid expansion, from what I understand, when we were in Raleigh, the elected officials that we spoke to were unwilling to move forward on this, and I think there's still enough of that there that it's not going to move forward unless there is a stipulation.
Well,
I guess what I'm trying to say is there are people that are on the fence. Let's say some Republican officials.
that might change when
not,
the governor issues a veto.
Well, I would love to see that. I don't know. It's hard for me to speak on their behalf. I just feel like it's not there yet.
Right.
I really feel like there's enough muscle left in the Republican Party and its officials to put a stop to it, to put a stop for trying to pass this. We have more work to do, but the longer this takes, the more people suffer, and so that's what I'm looking at it. And so again, we're not out here to bash parties, but we're here to push an agenda that's necessary.
So it's really up to us and gathering a movement behind this. And so people who are watching this and listening, call your senators and representatives on the state level. Tell them to support House Bill 3 and Senate Bill 5, and make sure you stipulate that we want clean
Medicaid
expansion with no stipulations.
Right, and the other thing I could say is don't be ashamed to say why you want to see clean Medicaid expansion. I mean, if I call, then I say, I too understand suffering from lack of health care coverage, or, my elderly mother, I wouldn't know what to do if I didn't have access to this coverage. There's a lot out there that you can say, and that's what we're wanting people to stand up and to their elected officials, call them, email them, write them, whatever you can do, and tell them why, and tell them how this affects you. Absolutely.
And it's also important for people to show up on April 22nd at this Medicaid expansion town hall in Waynesville at the Moot Center.
Correct.
What time?
It's from 6 to 8.
6 to 8 p.m.
Is about the time frame we're looking at, and then right after that, we'll have kind of like a Q&A session again for people to share their stories, ask questions for the medical professionals that we're hoping that we'll have a full panel with. I think actually I might be sitting on the panel, but we're looking for people other healthcare stories, because I've shared mine so much through Down Home that we're looking for other people to be on the panel as well. So I invite you, if you have any questions, please look at Down Home North Carolina website, our Facebook page. There are numbers to call to for people if you have questions.
What's the address of the venue? The Moot Center. It's on Virginia Avenue, I believe.
Virginia Avenue. I'm sorry, I don't think I brought the address with me.
For those who know Waynesville, it's
correct. It's the Moot Center.
Moot Center on Virginia Avenue.
Correct.
In I guess South Waynesville or West Waynesville.
I think it's considered West Waynesville. My apologies, I didn't bring the address with me, but we do also. If you go on to Down Home's website or the Facebook page for Down Home, I believe there is the information already put for the town hall meeting.
So we want this to be a newsworthy item, and I assume the press will be invited, and we hope that they'll show up, and Mountain Stream
hoping so.
TV will be there.
And we had our last turnout, I believe, generated over 100 people for a town hall meeting. So we're really looking, and we're asking people to show up and get informed, stay informed, pass along information, pass along your stories. This is to bring the community together, to let people know that they're not forgotten about and that people do care, and we want to see everyone healthy and productive, and we have some work to do, and it's might be slow going, but it can be done.
So, and that's again April 22nd, which happens to be Earth Day For those of you.
Oh, is it Earth Day? I
It
thought
is
it was
every
April
year,
23rd.
April 22nd.
The 22nd.
Is Earth Day. So this would be a good way of celebrating the Earth
That's
and the people who
right.
live here.
Send along some positive energy to Mother Earth. Absolutely.
That's right.
Absolutely. Yes. So we're looking forward to, again, April 22nd, the Folk Moot Center.
6 p.m.
6 to 8 p.m. A
Right.
Q&A session afterwards.
Go to what's the
Yep,
website?
Downhomenorthcarolina.org.
.org, okay.
Right. Or if you're on Facebook, just type in Down Home North Carolina. Now we have different chapters, but we do have a Waynesville chapter, a Haywood chapter, and a Jackson County chapter. So we should have the information posted on both sites.
Very good.
But it's so you might have to scroll down because we have different events that come up. But
Okay.
by all means, there's contact numbers or address there if you need to. And my name is Carrie McBane, being a member of Down Home North Carolina. And if you actually have any questions for me, my email address is cmcbane@downhomenorthcarolina.org.
McBane is McBane.
Right, correct.
Okay.
Correct. Actually, it's at downhomenc.org. Pardon me. So cmcbane@downhomenc.org.
Okay. Thank you again for being
You're welcome.
with us today,
Thank
Carrie.
you. Thank you.
And we'll see you again, I'm sure, and I'll certainly see you on the 22nd.
Okay, wonderful. Thank you. We look forward to seeing you.
Okay, have a great day.
Thank you.